Hello there, listeners. It's Susie New from the Australian Society of Anaesthetists, and welcome to episode 101 of the Australian Anaesthesia podcast. Thank you for joining me as I dive into the who, what, and how of some of the innovations that are happening in our world of anaesthesia. For regular listeners of the podcast, thank you, by the way, you may realise that I've just changed up the introduction to the podcast a little. That's because since the last episode, the bonanza that was the 100th episode, I've been doing a little bit of reflecting. And I've come to realise that there are a lot of anaesthetists doing some great work out there, getting programs up and going, making life better for patients and for us anaesthetists as well. And their work, their motivation, that might be hard to come across and understand in a scientific paper, or maybe their story needs to get to us in different ways, like in a podcast. So my plan, for the next few episodes at least, is to seek out those people, those conversations, and share them with you. Maybe they might inspire you. Maybe you might learn something. Maybe their ideas might challenge you. Who knows? But there's only one way to find out. So now I've said all that, I am super excited to introduce this episode to you. I'm chatting with Dr. Sarah Lee, an anaesthetist from Melbourne who has been working incredibly hard on something called Advance. These are CPD sessions which qualify for those hard-to-earn Practice Audit CPD points. Yes, in this episode, I'm going to outline how you can participate in these meetings and get those points. I really like this conversation because I am inspired by her interest in medical education and making it accessible. And I really like good ideas, and I'm super impressed with how hard Dr. Lee works. I also want to send a shout out to Jenny up in Cairns. Like Sarah, another inspiring educator, hard worker, and lovely, lovely person. Thank you for your kind feedback about the podcast. All right, I should mention that at the end of the episode, I'll share with you how you can get involved. That's enough from me. Let's get into it. Thanks for giving up some time this morning for me / evening for you. I really wanted to talk with you this morning, Sarah. I wanted to get to know a little bit more about you, but you're just doing such amazing work with Advance. So I really want to find out heaps more about it and also just spread the word about it because I think it's such a great thing that you're running. But first of all, tell me, you're an anaesthetist in Melbourne?
Yes, Susie, thanks so much for having me today. So I am a staff anaesthetist at Eastern Health. I'm about 4 years out. So in addition, I'm also a VMO anaesthetist at the Royal Women's Hospital. And that's because I have a specific interest in obstetrics anesthesia.
And apart from being a clinician, have you had a long-standing interest in education, in CPD? How has this come about?
Yes, I do have a great interest in education. I'm also the supervisor of training at Eastern Health. Advance was really inspired by a wonderful meeting started up by Dr. Nam Lee, and it was actually born out during the peak of COVID. So in 2020, the department's morale was down similar to elsewhere, and Dr. Nam Lee actually came up with this brilliant idea, and he came up with this meeting called Panacea. Now, it's essentially similar to Advance, but it was limited to an obstetrics-based theme. So he would come up with a topic, and I was the fellow that presented at the very first meeting. And the first topic that we did was on the optimal volume of epidural blood patch. And so we got together via Zoom, and we compared each other's practices, and it was really good to see what my consultants in the department were doing on something as simple as that, and yet there was such a wide variety of practice. And so when I transitioned to being a consultant, I thought, what an excellent idea, and if I could bring it to Eastern Health, how fun would that be? But I didn't want it to be just obstetrics based. I thought, maybe this could be on any sort of subspecialty, any topic really. And instead of just limiting it to a single center, why not invite other networks? Because how interesting would it be to be able to compare what you're doing, let's say in Eastern Health, in obstetrics and aesthetics? What are our tertiary centers like the Women's and Mercy Health doing?
Absolutely.
Are we doing similar things? Are they doing anything else that we have not been incorporating into our practice?
Exactly, because practice changes over time and you find that some centers are doing one thing and other centers are doing another.
Yes, absolutely. And then the one thing I was really quite keen on doing is really supporting So I have a lot of friends who came out and they weren't as fortunate as me in terms of landing a staff position. During COVID, jobs were very scarce. So a lot of my friends were going into private, and that wasn't particularly their hopes. As a junior consultant, you want to be supported in big public hospitals.
Yeah, it can be very isolating going straight into private as a junior consultant, for sure.
And so I was thinking that if Advance could really support our practitioners who have a bit more of a solo-based, private-based practice, or even the clinicians who are working more in the regional centres, the district health, smaller hospitals, that would really support them.
Absolutely.
Yeah, that was my hope. And so far, the feedback has been good. We've been getting lots of interest, people emailing to say that they would like to join more of these events.
Yep.
It's nice to see that people are actually finding it beneficial.
But maybe for people who haven't heard about Advance, do you want to just run through what the format is? And then I'll come back. I want to ask you some more questions about how it's going and where it's going.
Absolutely. Advance, it's about an hour and 15 minutes long. I try and keep it short because we try and do this after hours, after people have had a busy list. So it's usually on a weekday. So far, about 6 of the 9 meetings that we've held has been virtually, so via Zoom, essentially. We had 2 hybrid meetings. That took off very well, but it took a bit more coordination, and the technical difficulties there, I still need to master it. So
Not that you need to master, but they're much more technically difficult having hybrid meetings. Everyone assumes it's straightforward, but they are not.
Absolutely. So yes, back to your question about Advance. Essentially, we choose a topic, any topic in anesthetics. So it could be obstetrics-based or even the pediatrics one that we had fairly recently. And we send out a pre-meeting survey that has about 10 questions. And we ask people a range of questions. For example, what is their choice of analgesia when it comes to the management of a person undergoing a liver resection? Would it be things like thoracic epidurals, or do they elect to do something like intrathecal morphine, or are they using more methadone or IV opioid-based techniques at the moment? And so the survey has about 10 questions, and then prior to the meeting, I will collate all these results and then do a sub-analysis. Now, this part takes a bit more time because my hopes are to really compare whether different networks are doing different things, whether there's a preference. For example, St. Vincent's is very renowned for their regional-based practice. And my hopes are to really compare networks' preferences, but also to see whether, depending on your years of practice, so let's say a more junior consultant, do they lean towards techniques like intrathecal morphine versus our more experienced consultants where thoracic epidural might be a technique that's more familiar to them? And then on the day of the meeting itself, we go through all the results from the surveys, and then we do quite interactive polls with the audience and call upon the experts in the audience to share from their practice. Now, that part is always a bit difficult, Susie, as we have about 150 to 180 attendees for the last few meetings. And whilst that's fantastic turnout, where my concern has always been is to make this engaging, make this as interactive as possible. As we know, audience can sometimes be quite shy to share from their practice. So that's something I still need to master, about how to encourage people to actually share and not be afraid to talk about their own practice, because we're just here to really learn from each other.
I'll have lots of thoughts on that. But I think what's great is you frame it within a number of cases. So you get people really engaged. It's either a real case or it's based on a hypothetical patient. In terms of your panel of experts, what I really like is that it's multidisciplinary. It's not just anaesthetists. The ones I've been to, you've always had surgeons, but you might also have other physicians, like with the pediatric tonsillectomy one, you also had some pediatricians as well. So I think that's been a real strength of the meeting. So well done there.
Thank you very much, Susie. Yes, they've been very supportive. We've had, as you said, the physicians, the pediatricians, the intensivists, and for one of our topics we did around NOFs and the perioperative management of these a bit more frail cohort of patients, we also had the physicians and peri-op medicine physicians come to the event as well. And it's always nice to hear their perspective, because as we know, that definitely changes or at least adds a different input into the way we might manage our patients.
And in terms of driving engagement, because you've got the experts in the room and you also have some people that you can call upon who it sometimes helps to break the ice for other people.
Yes, I do rely on the more vocal and outgoing personalities to actually start the conversation going. That's always helpful. It's also a bit of a challenge sometimes because there's such a variety of audience who are attending. So it can range from trainees who are preparing for their part twos all the way to experts whose articles you're actually presenting. So in order to make it engaging and worth people's while, the questions need to be fairly targeted and I suppose really pose the real world issues associated with our anesthesia management.
I also like that you're looking at how practice might change with different age groups, because I certainly noticed that when I was a registrar, that you would see the different practices with the different consultants, and you could almost see that some of them had trained in a certain technique and they hadn't really modified it that much because in their hands it was perfectly safe and they were doing it for so long, so well. So why would they change?
It's been very nice to have the feedback. So after the advance that we recently held on the upper GI surgery management of the more complex cases, I had a few texts from some of my colleagues from different networks saying, we attended the advance the other day, now I'm going to try and put maybe a small dose of dexmedetomidine into the spinal. I'll be considering using methadone instead today, given that my patient doesn't want Neuraxial. And it's nice, not so much that we're trying to change people's clinical practice, but more for people to think about the range of things that actually exist out there, not be afraid to try techniques that their friends and colleagues might be using, obviously where it's appropriate and safe.
Exactly. For all the literature that is out there, we're still very much like an apprentice model, and you hear about techniques. Things in the literature are generalizable, but you can't always immediately apply them to your practice.
Yes.
Now, I wanted to talk about what you do after the meeting, because that seems like an incredible amount of work as well.
Thankfully, I've had advanced trainees do the literature review, and they do immense amount of work on that area. The nice thing is that they get to sign off as a scholar role activity for their audit, so they love it. But the actual summary report, myself and usually my co-chair would sit down and go through all the discussions that were made during the meeting, all the poll results, and then for us to further sub-analyze to see whether or not, as I mentioned, whether there was any specific trends in networks or in subspecialists, whether our pediatric subspecialists are doing things slightly different to our generalist. That's always very interesting to see. And the report can sometimes be 20 to 30 pages long. And I don't know whether the audience would read through everything, but I suppose they can screen straight to the poll results and the survey results for what they're looking at or what they are interested in reading more about. Yeah, that usually takes up quite a bit of time.
Well done. I think the reports are fantastic, and I agree. They're very comprehensive, but you don't know what it is that people are going to go back and look for. It might be, as you said, one person wants to know, what's the dose of dexmedetomidine for spinals again? And another person might want to know, when is it safe to put that epidural catheter in, and all those sorts of things. You mentioned CPD, so that's the other great thing about this initiative is that it qualifies for those very hard to get CPD points. So I suppose that's very straightforward.
I suppose as the meetings grow, I need to find a way to keep this really interactive and for the participants to actually engage. But the intent really is for people to reflect on their own practice and to see whether it's in keeping with their peers and big teaching public tertiary centres. If that aim is achieved, then I suppose Advance has achieved one of its aims, which is to really get people to reflect on their own practices and to see whether it's evidence-based as well when we present the literature review.
I think it's definitely achieving that. I hope you are getting a lot of clinical support time in order to make all these reports and prepare all these meetings.
Yeah, I could not have done it without my department being very supportive. So the directors and the team have been great support. No complaints there.
Yeah, great. I wanted to ask, you mentioned it a couple of times actually, have you got plans to expand? So perhaps invite practitioners from all around Australia, or what does the future look like for Advance?
Absolutely, Susie. I definitely love that. And my hopes is to make it more interstate, as we've got Canberra coming for quite a number of our meetings so far. And we've recently presented at the Art of Anaesthesia Canberra meeting on the 23rd of November. That was an in-person one, so that was taken very well. And I'm hoping that I'll be able to invite more hospitals interstate. I've got practitioners who are visitors from New Zealand also asking to have their hospitals join us for more virtual meetings.
Yeah, great.
And then, some of my fellows who are returning home to the UK are saying that they would love to also involve their hospitals in it.
Wow, go global.
But the difficult thing though, Susie, is the time difference. So it's going to be hard to coordinate that sort of virtual meeting with more international hospitals, but we'll see what we can do.
Yeah. Have you thought of, say, changing the format of all so that people could, because of things like time differences, could perhaps do the survey in their own time, do a semi-interactive presentation online in their own time.
Yeah, it's absolutely a great idea, and I would be keen to hear any ideas that you might have as we expand further, because I think that will be the biggest challenge, being the time difference. One of the things that my eventual long-term hopes are is really to build, with the surveys that we're getting so far, we're getting about 200 plus surveys for each meeting, and they're really excellent data, and my hopes are to build something like a local practice, even for Australia, New Zealand, a database on what practitioners are doing on a range of things. Because imagine, let's say you're covering a list and now you've got a lady who's coming in for cervical circlage. I've not done a cervical circlage, for example, for a while, and I've forgotten the dose of local anesthetic. What is the trend? Do people tend to go more towards GA still, or a spinal dose, and how much do they actually put in? And actually knew what my peers are doing. And if there's such a database that exists where I can look up and go, hey, 80% of my peers are doing this for this, then it's a lot more reassuring for the practitioner.
Absolutely. I don't know if you've seen on the ASA website, we've got the anaesthetic recipe book.
Yes.
That was the idea behind that. It's for those times when you're covering a list for a friend, as you say. The one that's been most popular is thyroidectomy. You know, there's some people, especially the ones in private, who have done thousands of thyroidectomies.
Yes.
And they are so slick. And that day that you are covering that list for your friend, and you can do it safely. It's maybe been 6 months, 8 months, a year since you've done one, but you want to come in there, you want to be slick, you want to be confident.
Yes.
So I think anything that helps in that format. And I think it's interesting that you mentioned about building the database. That is a great idea. The other thing is, do you think you'll publish some of this?
Yes, so one of my good friends, Nick Cruvilla, was actually saying that I should probably consider publishing some of these articles. Maybe as a article on the ASA website, like a summary report that this was actually something that we discussed that would be quite useful. And now that you're talking about it, I should probably have a good think about this. I'm not the best at publishing things, Susie. I do think that it'll be worthwhile because there's just so much data that's collected from each meeting that it'll be a pity not to be able to share it with other practitioners who might have missed out or who don't know about Advance.
Exactly.
So I think that might be something to pursue.
I get your hesitation about publishing. I too am not the world's best publisher. And because I think that it's such a process, and sometimes you submit something and then it comes back to you for review 6 months later and you think, my brain turned off, I'm on to the next project. Now I have to open that section of my brain and I have to revisit it.
Yes.
But I wonder, again, if the information that comes out, like the practical, the clinical information that comes out, whether it's quicker being disseminated either through a video or a podcast at the time, and then that's in one way published. But I wonder in terms of scientific publication, whether you thought about just the process of setting up Advance, how it was set up, how many meetings, how the audience has grown each time, what the basic format is, because people might in another country read it, come across it and want to replicate it in their own setting.
Yes, absolutely. That's a great idea. I haven't actually thought about that, but I would be keen to pursue that because I think one of my hopes also is to encourage people to maybe adopt Advance as well in their own countries, in their own settings, and take turns hosting it with us. It would be good for other networks to also join in and maybe we take turns. One session, it might be Eastern Health doing the hosting, and then another session, it could be the Northern or some different network. It's quite fun, actually. I'd say I take a lot of joy because I do a lot of the reading, going through all the literature review.
You are so knowledgeable.
It certainly does help refresh my memory, just really good reading. So I quite enjoy it. I'm not sure about the others, whether they would enjoy that kind of preparation, but I think it's worthwhile giving it a shot and having other networks also see whether this is something that they would like to do as well.
It's interesting you mentioned people from other countries. A few years ago, I was asked to be a judge for a poster competition. And this was for a conference in Asia. And one of the papers that I was judging was from a country in Asia. And they talked about the addition of an opiate to their spinal for caesarean section.
Yes.
And it was presented like this is a very novel technique. And they measured the duration of the block and the success of that and whether there was any respiratory depression, all these sorts of things by adding, I think it was fentanyl. And it just made me reflect. I thought, what is their usual practice in that country when it comes to spinal anaesthesia for caesarean? Yes. This is bread and butter. We would never dream of not supplementing with an opiate. So it just really made me appreciate the regional differences, and they can be very significant across the globe, let alone within our own country.
Absolutely. It's interesting that you mentioned that, because in our latest advance that I mentioned in Canberra, two of the papers that we talked about was adding intrathecal buprenorphine to spinal, something that we don't do in Australia. But interestingly, they do quite a bit in countries like India and Pakistan. And they are showing that you don't get as much side effects with pruritus, urinary retention, certainly. So yeah, you've mentioned something that really shows the point of there's such a wide range of practice just interstate. In Canberra, they use a lot of methadone for their general anaesthetic cesarean sections, whereas in Victoria,
Really?
we barely use, and certainly at the women's, we don't. So there's such a huge range of practice, even within the country itself, let alone if we were to bring advance and compare it with other countries, we'll certainly learn a lot. There'll be a huge difference in the practice.
So much for you to conquer.
Yes.
In this advanced world that you are leading. It's certainly very exciting, and I can't wait to see what you do with this. I think it's just a fantastic initiative. Before we wrap up, is there anything else that you would like to say at all?
I just wanted to say thank you very much again, Susie, for inviting me and allowing me to actually share advance with your audience. Certainly, it's, as you mentioned, a lot of work, but I would have to say that the team does a fantastic job really supporting the work that goes into this prior to every meeting. And really, I want to encourage anyone and everyone is really invited to this meeting. If you think you might enjoy and benefit from learning about others' practice, please register your interest. I'm not sure what the best way is, but in the meantime, anyone and everyone is encouraged to attend if they are interested to see what advance is all about.
Great, that's fantastic. And maybe if people are interested, they can just contact us via the podcast email, and then we can pass their details on to you. All right, lovely. Thanks, Sarah. No, thank you for your time.
It's lovely to have a chat with you. Thank you.
Well, I hope you are as impressed with Sarah as I am. What an incredible idea, and how amazing is she to keep bringing it to us and getting it better and bigger, and wow, so impressive. Are you inspired to get involved, or at least come to an advanced meeting and earn some practice audit points? Well, I can tell you that the next meeting is coming up soon. It's on Monday, the 26th of May, and it will be on thoracic anaesthesia. If you'd like to come, then please send me an email on podcast@asa.org.au and I can forward you the registration link. If I am able. I say that because the meeting is capped at only 300 attendees. And having been to a few of these meetings already, I can say that those spots will fill up quickly if they haven't already. So please don't delay if you're at all interested in coming along. The other thing is, if you have missed out on a spot, you can't make it to the meeting because you've got other commitments and you would still appreciate a refresher on thoracic anaesthesia, then I invite you to look at the anaesthesia recipe book. It's on the ASA website, it's only available for our members, and we've just added the latest recipe, which is all about thoracic anaesthesia. Dr. Nicole Fairweather shares some of her tips and insights into thoracic anaesthesia, and this is coming from someone who does on average 50 double lumen tubes a year, so there is some gold in there. Anyway, there are definitely more advanced meetings planned for the rest of the year, and when it comes to advance, things are advancing, get it, all the time, which means that I expect things to change, and quite possibly some of the things in this podcast might be out of date by the time you're listening to it. I don't think the basic premise of advance will change. It's going to keep building and being a fantastic CPD meeting. But I expect details on how to register and possibly where you might be able to find recordings of the meetings. Those sorts of things might change. If there are any changes, I don't expect I'll be able to update the podcast, but what I think I can do is update the episode notes. So do look in there, scroll down, or wherever you find them in your podcast player. Go looking for those latest links. And also, if you're ever unsure, you can just email me on podcast@asa.org.au and I can send you the latest information. All right, I hope to see you on Monday the 26th of May, and if not, at another advanced meeting sometime in the future. And of course, in the meantime, I hope you and your patients are staying safe and well out there.
This has been Australian Anaesthesia, produced by the Australian Society of Anaesthetists, with many thanks to host and editor Dr. Susie New, with music by Soda Lime Music, sound and engineering by Bearview, and graphics by the ASA Communications team. For more content, please visit www.asa.org.au.